Hello everyone, welcome to Veterinary Small Talks, a continuous professional development program hosted by the Indian Veterinary Association Ernakulam unit. Today we are going to talk about Feline Infectious Peritonitis or FIP. As many of you already know, FIP is a very fatal disease in cats caused by a mutant form of Feline Corona Virus. In order to understand the FIP virus better, we should understand what is Feline Enteric Coronavirus. The Feline Enteric Coronavirus is a ubiquitous virus. It is endemic to most of the shelter cats. So as the name suggests, the Feline Enteric Coronavirus has a tropism, has an affinity to the enterocytes, the intestine. So this virus just causes a self-limiting infection. The cat clears the infection very fast. It doesn't cause any clinical signs. The maximum clinical signs that it can cause is a very self-limiting diarrhea. But out of this, a 10% gets a mutation and it becomes Feline Infectious Peritonitis virus. The FIP virus has an affinity to macrophages. So, as we know, macrophages are monocytes, the blood cells which are circulating throughout the body. So, this virus gets inside the macrophages and it stimulates a cascade of immunological reactions. And this cascade of immunological reactions causes the production of antigen-antibody complexes, and this antigen-antibody complexes deposits in the blood vessels, causing immunological reactions in the blood vessels, which results in vasculitis. The fluid that accumulates inside the peritoneum and inside the pleura in FIP is kind of a non-septic exudate that is with high proteins. The course of the disease is determined by the type and the strength of the immune response generated by the host against the virus. So, if a strong humoral immune response is generated against the FIP virus, the condition leads to a wet form of or effusive form of FIP. And if it is a cell-mediated immune response against the virus, then what results is a dry or pyogranulomatous form of FIP. So, what basically happens is the antigen-antibody complexes that is being generated inside the body, they all get deposited inside the walls of the blood vessels, and this leads to the inflammation of the walls of the blood vessels, which is called as vasculitis. A typical example of a local vasculitis is the pinna vasculitis, ear tip vasculitis that is being observed in dogs, especially the breeds like Dachshunds, where they have a crusty ears and most of them presents with the bleeding of the ear tips. There is cutaneous vasculitis also reported in dogs. So those are examples of local vasculitis, but in FIP what happens is a systemic form of vasculitis. So like every inflammation, vasculitis will also cause the cardinal signs of inflammation. Then there are a huge amount of inflammatory proteins, the acute phase proteins that is being produced inside the body due to the inflammatory mediators. And also this vasculitis process increases the permeability of the blood vessels. And when the blood vessels become more permeable, all these acute phase proteins, these inflammatory proteins, start to leak outside of the blood vessels, and this results in the fluid buildup inside the peritoneum and inside the pleura. The gradual accumulation of fluid inside the abdomen in FIP is typical of the disease. This fluid is a straw-colored fluid with high protein content. So this makes it easier to differentiate between the fluid buildup that is being caused by liver disease and congestive heart failure. So in a typical liver disease or liver failure, the fluid that builds up in the abdomen is because of low albumin content in the blood, that is hypoalbuminemia. So the fluid that is being collected inside the abdomen in a liver failure is a transudate. This is the same case with congestive heart failure though. So the fluid that is being collected inside the abdomen in congestive heart failure as well as the liver failure is transudate with very low protein content. But in contrast to that, in FIP, the fluid that is being collected inside the abdomen has high protein content. So this is a kind of non-septic exudate. So there is a classical test that can differentiate transudate and exudate. This test is called Rivalta test. So basically what we do is we take 6 to 7 ml of distilled water in a test tube, and then we add 1 drop of glacial acetic acid into the test tube. So this results in the pH range of around 4. So what we need is a weakly acidic solution. If we don't have glacial acetic acid is actually the concentrated form of acetic acid, that is 98% of acetic acid. So if we don't have the acetic acid, we can use vinegar as well. So we can take 5 ml of distilled water and add 1 to 2 ml of vinegar and make a weak solution by itself. Then we get the FIP effusion in a syringe and then carefully layer 1 drop of FIP effusion into the top of the our solution, that is the glacial acetic acid added distilled water solution. So what happens when a fluid mixes with fluid? It vanishes, of course, it disappears. But if it is a positive case of FIP, this fluid, this drop retains its shape, and it retains the shape of a globe and slowly pass down the test tube. So this is called as the jellyfish effect or the globe effect. This is due to the cohesive nature of the FIP proteins. Now coming to the clinical signs of FIP, most of the cats that are affected are below the age of 2, and rarely some cats can be affected above the age of 10. So typical presentation would be a young cat coming with a history of progressive abdominal distension. The owner may or may not note this abdominal distension, but what he might note is a history of tachypnea or tachycardia, and there will be anorexia, progressive weight loss despite a good appetite, and there can be symptoms of hyperbilirubinemia like jaundice, icteric mucous membranes. Also there can be some kind of nervous signs. So these are all the classic presentations in a cat with wet form of FIP, and in a dry form we would expect pyogranulomatous lesions inside the abdomen. So on abdominal palpation we would get enlarged mesenteric lymph nodes or irregular kidneys or any kind of nodular masses inside the abdomen. And typically in a dry form of FIP we would get ocular lesions. So the ocular lesions are very classic for FIP, and the typical lesion that we get is uveitis. So what we observe is a color change in the iris. The iris can turn to a brown color or a golden yellow color. So any color change inside the iris is typical of uveitis, and the same process can also occur in other diseases as well. So this process of uveitis can occur in feline toxoplasmosis as well as feline lymphoma.